Office and the county's Bureau of Technology for their partnership in making vital data accessible to all of us. I especially want to thank the following individuals for their dedication and leadership: Chair Daley, Commissioner Kevin Morrison, Commissioner Monica Gordon, Commissioner Maggie Trevor, Chief Medical Officer Dr. Pony Arunkumar, Chief Information Officer Tom Lynch, Chief Data Officer Rosie Branson, and the county's Geographic Information Systems, GIS team, led by Todd Schubel, as well as GIS developer Josh Kalov, who spearheaded this dashboard. Thank you, Josh. Where are you? Raise your hand. All right, good. I want to acknowledge Dr. Lamar Hasbrook, who leads Cook County's Department of Public Health, Avik Das, Executive Director of the Justice Advisory Council, and Chief Administrative Officer Zara Ali. Thank you all for being here and for your support. I also want to thank Michael Albert, who is our sign language interpreter for today. Under my administration, we've made it a priority to ensure that the public has transparent access to critical information. Today, with the launch of the Medical Examiner Case Archive Dashboard, we're taking another important step in that direction. This dashboard focuses on providing detailed information about opioid-related, gun-related, and extreme temperature-related deaths in Cook County. These are three factors that account for over 1/3 of all the cases handled by the Medical Examiner's Office in each year. Opioids and guns represent the two largest causes of natural deaths in our county. Unnatural deaths. And tragically, they're the most preventable and disproportionately impact our African American and Latino communities. In 2023 alone, 72% of the 1,821 opioid-related deaths in Cook County were among communities of color. Even more alarming, 86% of the 942 gun-related deaths were of Black and Latino residents. You know, let me just say, the gun violence in our city and county gets a lot of public attention. The opioid deaths, much less so. But as you saw by the statistics I just gave you, the opioid deaths on an annual basis are twice what the gun violent deaths are. This new case archive dashboard will allow users to access this crucial data, revealing where these deaths are happening. And by the way, the communities that have the most violence are also the same communities that have the most opioid deaths. The dashboard will reveal who's most vulnerable and breaks down data by age, gender, race, and ethnicity. So as hard as these numbers are to deal with, we must face them head on. Our partners in public health, healthcare, government, and the private sector can now use this data to work collaboratively toward solutions that are driven by facts and evidence. Let me be clear. The goal of this dashboard is not merely to present alarming statistics. Our goal is to ensure that one day tools like this are no longer needed. My challenge to all of us here today is to continue working toward that future. I'm hopeful for a future where the lives behind these numbers are spared. That journey begins with confronting the reality in front of us and committing to meaningful change. I want to thank all of you for joining us. I would ask Chairman Daley to come up next. And would each person introduce the person who follows them? Thank you, Chairman.
Thank you, Madam President, and my fellow commissioners and bureau chiefs. Let me congratulate the administration on this great achievement, among many. As the president outlined, this is a beginning of a dashboard to resolve the issues that have been out in our community for many years. And this administration has attacked many of them, especially starting with Dr. Nutter's group, dealing with mental health and the deaths that were outlined today. It's an honor to work on this issue. I hope for the day that these issues are resolved, and I believe with the administration and the individuals behind me, fellow commissioners, it will be resolved. It's now my honor to introduce you Monica Gordon, Commissioner Monica Gordon.
Thank you, Chairman. Thank you to this administration, Madam President Tony Preckwinkle, my colleagues, everyone who's been involved in this great initiative. As we face the ongoing challenges here in Cook County and the Southland, especially in our underserved communities and our communities of color, it's important to come together with the right tools and knowledge to make a difference. We know all too well the pain caused by gun violence, opioid deaths, and extreme weather. These issues aren't distant, they're real, and they affect the lives of our friends, families, and neighbors every single day. We need to have access to real-time information that can help us truly understand what's happening and allow us to find real solutions. The data isn't just numbers, it's about saving lives. And it's why having the right information at our fingertips is crucial to the work that we're doing right now. We're not just talking about data with this work or with this new tool, we're talking about empowerment. Empowerment, whether you're a public health worker, medical professional, policymaker, to use this tool to take action. Whether it's improving health resources, reducing gun violence, or preparing for the next big storm, this tool will help us make the decisions that save lives right here in Cook County and in the Southland and the far south side, my district. So, we will all get involved, use the resource, and together we're going to shape policies that make sure our communities are safe, healthy, and resilient. Thank you. And next, I would like to introduce my colleague, Commissioner Maggie Trevor.
Thank you, Commissioner Gordon, President Preckwinkle, my colleagues on the board, and everybody here who made this happen. I am Cook County Commissioner Maggie Trevor from the 9th District, and my professional background is actually in social science data analysis, and I have seen the power that and the ability to come up with solutions from data just like this. I applaud this effort for for transparency, for working to find real solutions to real problems, and like my colleagues, I hope that not only can we see these numbers now, we can actually publicly see these numbers decline as we find solutions to gun violence, to the opioid epidemic, and to all of the other issues that this data will help us tackle. I'd like to introduce my Chief Medical Examiner, Dr. Pani Arun Kumar, who will speak to us next. Thank you.
Good afternoon.
Good afternoon.
I want to begin by thanking President Preckwinkle. Your principled leadership is guiding our entire team as we do very challenging work at the county's medical examiner's office. I'm also so grateful to Tom Lynch, Rosie Branson, and the Bureau of Technology for working to make our data even more accessible to everyone. While the primary responsibility of my office is to determine the cause and manner of death for the decedents who fall under our jurisdiction, I believe we have a moral responsibility to do much more. Under President Preckwinkle's leadership, stances that have led to their deaths. Many times, those deaths could have been prevented either by enhanced access to health care or other intervention services. Our data shows that decedents who lived their lives in under-resourced communities have more comorbidities and lower life expectancies. Our data also shows that communities of color are hardest hit. When it comes to opioid-related, gun-related, and extreme temperature-related deaths, as President Preckwinkle noted, these are the residents that are most impacted. In fact, although less than 23% of Cook County's residents are African American, they account for over 68% of gun-related deaths and 57% of opioid overdose deaths. It is our responsibility to share as much information about these victims and their environment as possible. Public health needs to know, policymakers need to know, the media needs to know, because our residents need to know. That is why the Medical Examiner Case Archive Dashboard is so vital. This dashboard enhances our ability to provide data specific to opioid-related, gun-related, and extreme temperature-related deaths, so the people on the front lines can easily access information about where the deaths are occurring. This can help us identify clusters and surges and hopefully help us make the best decisions to save more lives. Ultimately, that's why my team of forensic pathologists works every day to determine the cause and manner of death in our patients. It is the hope that the information we uncover can be used by others, maybe even some of those who are watching this press conference right now, to make the changes in our community to extend the length and enhance the quality of life of every resident, regardless of their zip code. I hope everyone takes advantage of this new tool in our website. Knowledge is power, and in this case, knowledge has the power to save lives. Thank you. The next speaker is Dr. Lamar Hasbrook, the Chief Operating Officer for the Cook County Department of Public Health.
Thank you. So good afternoon, everyone. I also want to join the chorus of thanking President Preckwinkle, also Dr. Arun Kumar and her team, the Bureau of Technology, and everybody behind this, the champions that are behind me and those who aren't here present today but can hear us and are viewing this and who will be mining this data source to make changes and impact. So I lead the Cook County Department of Public Health when we're in the business of building healthier communities every day. We work to prevent illness, injury, and premature deaths. So this dashboard is going to be very vital for the way we do our work and how we do our work, because it provides data right down to the municipal level, which is that kind of impact data that we need. Data isn't always information, but data that's well organized, data that's visualized, eventually transforms to actionable information that can lead to data-informed decision makings. So that's things like interventions, prevention strategies, resource allocations, community activation, and community mobilization. So that's what we have here in this tool. The interesting thing about the things that we're looking at, the causes of death with this particular data dashboard, as has been mentioned, they are unnatural causes of death. And when it comes to violence and when it comes to what is it? Opioid overdose. Yeah, thank you. That they have a tremendous impact on life expectancy. And why is that? That's because folks who die of violence and those who die of opioids typically die in their 20s and in their 30s and in their 40s. So they're forfeiting 20, 30, 40 years of life. And that makes this very, very important. The other reason why it's so important is because these causes of death are preventable and not inevitable. So just in closing, let me just share with you how we take data to action. So using this type of data, that is opioid data, we most recently went into the village of Maywood. We noticed that they had one of the highest rates of opioid deaths in suburban Cook County. We got with the mayor, we got with surrounding mayors, we brought in Speaker Welch, we did a call to action press event. We spent an entire day training peacekeepers, community outreach workers on how to use naloxone, the antidote to opioid. We had educators in, we had faith-based folks, and we spent an entire day educating, doing what we call opioid education and naloxone distribution. Everybody that left from the end of that day at 150 folks had in their hands Narcan and the knowledge, most importantly, to use this reversal drug. So that's the kind of impact that this kind of data can have. And so we're not only an advocate and a champion of it, we are an eager user of this data and this data dashboard. Bottom line, that this is a win for our work and this is a win for the County of Cook. And with that, I'd like to introduce Avik Das, Executive Director, Justice Advisory Council.
Good afternoon.
Good afternoon.
On behalf of the Justice Advisory Council, or JAC, I commend Dr. Arun Kumar, the Medical Examiner's Office, and all the collaborative leadership efforts that contributed to the creation of this important resource. The JAC operates under the leadership of President Preckwinkle, and we work to advance the County Board's efforts to support communities closest to the impacts of violence and contact with the criminal legal system. Through policy innovation, system and stakeholder collaboration, significant grant making for community-based organizations, the JAC centers the safety and well-being of all residents, including those most affected by gun violence. I am joined by my teammate, Dr. Whitney Kitawi, the JAC's Director of Data and Research, and I am grateful that we benefit from her leadership and expertise to meaningfully connect the medical examiner's information to the myriad data and research we rely upon to shape our community safety strategies and investments. Indeed, The dashboard announced today enhances our team's ability to locate and analyze the geographic overlap between communities experiencing, for example, overdose deaths and the highest concentrations of firearm-related shooting deaths. And then we get to dig deeper to understand the availability of behavior health resources, social service programs, supporting people recovering losses and community violence. The Chicago death gap is still a reality. For example, people living in the East Garfield Park neighborhood live, on average, 16 years less than people living in the Loop. This has only worsened since the pandemic. These additional insights build upon our collaborative work with Cook County Health, Department of Public Health, and our court and law enforcement partners, and they combine with data shared across state and city governments and research institutions. Ultimately, these data bring down silos across systems that serve the same communities, but across different related areas. By visibly connecting the dots between a person's experience of gun violence, tracking where they are occurring throughout the county, and understanding challenges faced to access such critical services like quality health care, transportation, or housing, we are better able to attend to the well-being of our residents more holistically. Thank you again to the many hands that made this important resource possible, and ultimately thank you to all our colleagues and partners helping to build a more safe and thriving Cook County. And now it's my pleasure to hand off to Chief Information Officer Tom Lynch.
Thank you, Avik. Thank you. Good afternoon. Good afternoon. Thanks so much for being here. As you heard from my colleagues, this medical examiner case archive dashboard is incredibly important with highlighting data that has impact on public policy. Specifically, we're talking about mortality information related to opioids, temperature-related death, and gun violence. But I like to highlight how this happened. This represents a tight collaboration between multiple offices, including the Bureau of Administration with the Medical Examiner's Office, as well as the Bureau of Technology, both our GIS and our data analytics divisions, led by Rosie Branson, our Chief Data Officer. By working together, technologists can enable the tools that can help the important work of many of the folks that you've seen here today. The dashboard includes clear, accessible data on deaths in Cook County, and using multiple filters, users can break down those fatality data by location, time, and other relevant factors and demographics to generate insights. That level of transparency is really important to identify the areas of need to better address public health challenges. We don't like to implement technology for its own sake. The purpose of my bureau is to support the functions of all of the good folks that you see here with me so that we can, as a group, try to address these important public policy issues. And we work with others, not just within the administration, but residents, community organizations, researchers, and other policy stakeholders. Collaboratively, we can work together to solve these important issues, and the data visualizations help make that more actionable. The dashboard showcases how to leverage technology to support the data-driven decision-making that Avik spoke to. And I think that concept is pervasive through the administration. We acknowledge that the problems are real and we need to address them, but we want to do it in a thoughtful, analytical way.
The information in this dashboard is based on data provided by the medical examiner's office. On the home screen of the dashboard, users will find a navigation bar along the left side of the screen, featuring a number of useful filtering tools. Using these tools, users can filter the data by manner of death. Simply click the drop-down list and choose the manner of death. Users are also able to filter the data by opioid, gun, heat, and cold related by clicking yes or no on the drop-down list. Another key function of the dashboard is its ability to filter the data by incident city by clicking and selecting a municipality. The data is also filterable by incident date and death date. Another useful function is the ability to search by race, age, and gender. As users filter the data, they will notice the dashboard changing in 4 key windows. These windows display death tolls, death by month, death by race or ethnicity, gender and age, as well as the map window. The dashboard also allows users to access existing functions such as the case archive map and other maps showing opioid-related, gun-related, and extreme temperature-related deaths in Cook County. You can also access these maps by clicking on the tabs above. Finally, when using the navigation on the top right, users can access the Medical Examiner Case Archive Open Data Portal, which provides public information about the MEO cases and a variety of means to filter that information. To use the new Cook County Medical Examiner Case Archive dashboard, visit maps.cookcountyil.gov/medexammaps.
All right, are there any questions?
Any questions in the room? A couple via email. For Stuart, how often will the dashboard be updated, and how will resident privacy?
And how is the privacy of the decedents maintained? So the data gets refreshed daily, twice in a day. So the users will see up-to-date data. With regard to privacy, we do not publish decedent names. And also the incident location is geocoded. The residence location just comes up as the zip code, so we don't give out addresses. That way we maintain the privacy of our patients.
The last one is, are there plans to add different factors to the dashboard in the future?
The question was, are there plans to add different features or factors to the dashboard? We are working with the Bureau of Technology to add more features. Some of the things we're looking at is to work on traffic-related deaths. It is not easy to search for them, so that's something we're working on, and we're working on archive data. We used to have data in a mainframe system to try to put that out. So prior to 2014, that data could be published, but that needs a lot of work. So that is something we're working on.